Welcome back. As you probably can guess, we're going to be talking health tips, and today we are focusing on ear care. So we'll have some ear care tips for you in terms of ear, nose, throat, and how the whole system is connected. I've got a special guest in studio. Dr. Maria Mudoka is a resident finalist, ENT head and neck at the University of Nairobi. Thank you for being here.
You're welcome.
So let's just start with the basics here. How about we start by talking about, in terms of cleaning your ears, proper procedures there, whether it's external cleaning that we should be focusing on, internal. Maybe you could just, start us off there.
Actually, you're not supposed to clean your ears.
You're not supposed to clean your ears?
Yes, inside especially.
Okay.
Would really discourage the use of earbuds. The ear actually cleans itself. The way this, it has a lining of skin which has sebaceous glands which produce the wax, the brown substance that you see. That's supposed to protect the ear itself. So you shouldn't clean it, because the way the skin grows, it grows outwards, so it generally cleans itself. When you use the earbud or the Q-tip, you kind of compress that wax and impact it, and
I'm sure that's a shock for some people watching at this point. Yeah. So you're talking internally, right? But externally, I mean, while you're showering or whatever.
While you're showering, you can clean. We have a professor who usually says the biggest thing that should go in your ear is your elbow, which obviously will not go in. So you clean just the outside part with like maybe a washcloth, but never inside. Never inside.
And you brought up the Q-tip issue, which I think has been debated by people for a while now. So no Q-tips are supposed to go inside your ear.
No earbuds, never.
Wow.
Because sometimes that little piece of cotton gets stuck inside, and as I said, the impaction of the wax. And some people come complaining of hearing loss. They say that sometimes is caused by just that wax that's impacted.
We had a graphic up on the screen just a moment ago before we get to hearing loss and all that. There it is. Maybe you can describe some of the more important areas that you should take care of in your ear.
All that we are seeing in the diagram, you can clean it, except you see where that part, the tragus is, where where the whole into the ear canal begins. You should not go inside there.
Okay.
Yeah. So you can clean all that outside.
Right.
Where the lobule is, the helix, the tragus, all that can be cleaned.
There are also people who have piercings on their ear. Maybe you can talk about how it is that we're properly supposed to care for that, and what we're supposed to be cleaning both our earrings and our sort of our earlobes with if we've got piercings. Okay.
For piercings, it's best to put in that part of the diagram called the lobule. That part has no cartilage. Cartilage is a type of connective tissue that's almost like bone. It's in between bone and soft tissue. When you put piercings where the cartilage is, it becomes more difficult to heal, and the cartilage tends to get infected. So you may find some people get infections where there's cartilage, but where the lobule is, there is no cartilage there. So you can put
a safer bet.
It's much safer.
Okay.
And when you have a piercing, it's important to clean it every day, maybe even twice a day. You can use spirit. You can use betadine. The good thing with spirit is, the only problem with spirit is that every time you open, the concentration goes down because the alcohol evaporates a little bit. You can use some betadine. The only problem with betadine, it may discolor. It may give you a bit of color change. But generally, by the time your ear heals after the piercing, you'll be good to go.
Yeah. That's interesting that you mentioned that the cartilage takes longer to heal, because I know of people who have, are they called keloids? Sort of like a small bump that develops after getting a piercing around the cartilage. Are those tough to sort of treat?
Yes, actually. For darker skin, for us Africans, and we tend to get to have healing of our skin tends to be a bit more overexpressed. A keloid is just actually the healing tissue heals with so robustly that it goes out of the margins of where the trauma was. And then it presents now as a keloid, which happens for mostly, especially for African skin. Now, keloids are difficult to manage sometimes because you may remove it, it comes back.
Okay.
There are treatments for it. You can have, like on the skin, they usually excise it, remove it, and may inject some steroid to try and prevent it from reoccurring, and also may have some clips for pressing the tissue there, so that to try and prevent it from overexpressing itself, getting overexpressed. In other areas, you may also be advised to massage to try and make the collagen tissue realign itself with maybe like a Vaseline or olive oil. Yeah.
Wow, quite the process there. You talked about our ears being self-cleaning. What purpose does earwax then serve, and why are we always trying to get rid of it, for those of us who have not been educated yet that you shouldn't be cleaning inside your ears?
Actually, it's protective. It has a bit of an acidic component, so it helps to prevent bacteria overgrowth. It, you know, there are many insects that may enter the ear. They get stuck in it, fall and come out with it, dust. So it protects the external auditory. That part is called the external auditory canal before you get to the tympanic membrane, the eardrum.
So what is it that needs to have happened for someone to end up in a doctor's office having their earwax sort of removed? I've heard of the procedures that happen, and like what needs to have happened for that to be the case?
Well, for some people, as they clean, it gets impacted. It becomes, so someone may actually come saying, I haven't been hearing very well on this side. When I put the phone on this side, I hear okay. When I put on this side, there's a difference. Or I don't hear very well on this side. So they come, and the first thing you check, because that is one of the most common causes of mild hearing loss, is the earwax impaction. So they usually can use a probe to remove it, or they can syringe it. They use a bit of water, and it's with some pressure. There's a way they use it to kind of
extract the earwax. We have another diagram up on the screen there. This is the internal part of the ear. Maybe you can tell us what we're looking at, and especially for those people who are still using Q-tips, what type of damage are we doing here?
The problem with Q-tips, you see the ear canal before you get to the eardrum, which we also call it the tympanic membrane. When sound comes in, it's funneled in through the pinna, which is the earlobe, this earlobe, and the ear canal concentrates the sound onto the eardrum, which then concentrates the sound onto those three little bones, which we call the ossicles, and they then focus that sound so that it goes into the inner ear, and now it can be created, an electrical impulse is created, and it can go to the brain, and you perceive that as sound, and the brain can interpret what you're hearing. So here in the ear canal, when you use the Q-tip, you're mostly inside the ear canal. So the risks of using the Q-tip is scratching in the ear canal, and that can cause you can get an infection. This because the ear canal is covered by skin, and that skin there's still bacteria inside there that when you cause an injury can colonize where you injured and now cause an infection. The impaction, now remember, if you impact over there in the ear canal, that would make the sound not be able to get to the eardrum, and so some people will present, even the Q-tip itself can come off and get lodged inside the ear canal.
Cause an infection there as well.
Quite a number.
And maybe we can just talk about those infections and how it is that they impact, because you know we always hear about ENT, ear, nose, throat, somehow connected. What type of damage can that do if you have an infection in your ear? How does it impact the rest of the system? Okay,
for starters, in the ear canal, we call the ear canal the outer ear. The inner ear starts from from the eardrum onwards into where you see the ossicle, the last ossicle ending, and then that's the middle ear, and then the inner ear has the cochlea, and those three little semicircular structures are actually called semicircular canals, which are used for balance. Yes. Okay. And then this, what you see in the eustachian tube, connects the middle ear to the throat, and that, you see, the middle ear doesn't have a place where it gets its oxygen from. It can't get from the outer ear because the eardrum is there, and it can't get from the inner ear either. So it gets its oxygen, because it has a lining, it gets its oxygen from the eustachian tube. Yes. So when you yawn, that's why sometimes maybe if you're traveling for some time, there's an the pressure becomes... Or if you're on a plane as well. Yes, precisely. When you chew, you hear that pop sound when the air finally goes in from the eustachian tube into the middle ear, because the pressure is not equalized, the middle ear, you know, it's still using up the oxygen, so it uses it up and creates a quote-unquote vacuum, and the eardrum gets sucked in. So that's how you end up not hearing very well as you're traveling. Then you yawn and suddenly everything is so loud. Hear pop. Maybe we can talk about, we talked about, you know, not putting Q-tips in your ears. How do you feel about listening to music with earbuds? Can that cause some damage? And, you know, sometimes when you're listening to music on a gadget like this, it'll tell you if you increase the volume too much, it might do damage to your ears. Most people tend to ignore that. So why should we not ignore that? Oh, yes. In fact, that is something that people really need to pay attention to, because there are different types of hearing loss. And one that is becoming quite prevalent now is the noise-induced hearing loss. When you go to the club, it can be transient and it can be permanent. Transient, you go to the club, you listen to loud music, you come out, you really can't hear very well for some time, then it kind of settles down and you can hear again, okay? With the loud music, constant loud music for a certain volume, for a certain duration, can give you permanent hearing loss. That's the problem with putting the earbuds inside. Yeah. And you know, a lot of people tend to think like, oh well, maybe I'll experience hearing loss at a later age when I'm older. But it's mostly young people who are listening to really loud music. So does age actually play a factor? Oh yes, age does play a big factor. There's age-induced presbycusis. Generally from about the age of 45. Actually, if we were to present different sound levels, there's something a younger person may hear that you, as you grow older, may not hear. Some sound levels you may not, as time they go decreasing. So noise-induced hearing loss really can bring on the age-induced hearing loss much sooner. Yes. Okay. But all of us will have some form of hearing loss by the time we get beyond 45 years. Right. Yeah. So we're trying to sort of prevent that for as long as possible. And it's maybe in some at sound levels. Okay. Yes. Yeah. Are there certain medications that also affect your hearing, or maybe you can talk to us about what those might be? There are quite a lot of medications that do affect. Some antibiotics like aminoglycosides, which we use for maybe like quite a number of infections actually. Some antihypertensives may also cause some form of hearing loss. Some of the pain medications. It's important to even quinine is well known for causing quite a bit of hearing loss. So it's important so you can imagine if you have a lot of noise-induced hearing loss and you're on some medications, even HIV, some of the medication, the ARVs, can cause quite a bit of hearing loss. Yeah. So you can imagine all those, if they were to add up. Right, and just compound. So I think it's important to get that type of information from your doctor. It's very important. As you're being prescribed this medication. You know, like I was saying earlier, there are people who tend to ignore
hearing loss or, you know, issues related to the ears, at which point would you encourage someone to come see you as a specialist for ENT if they're having, you know, sort of questions about things that are happening with their ears?
Well, anytime you feel that maybe you have questions, you can just, it's all right to go and be seen by the ENT. If you feel that maybe there's some hearing loss, you see, hearing loss may also be seen in small children, especially when they have large adenoids, or the adenoids may not necessarily be large but may be associated with infections in the ear. Those are the patients that come a lot. Patients on medication, they usually get sent to us and the audiologist so that they can assess their hearing levels. Yes.
So it's not a matter of just going to the chemist and getting eardrops, because, because we tend to type of self-diagnose quite a bit these days.
It's important. It's very important to be seen first, because sometimes the only time you need the eardrops is if you have a little hole in the eardrum and the middle ear has an infection. That's when the eardrops will make a difference. But again, diagnosis is important. It's very important.
All right, we're out of time. Dr. Maria Mudhoka, thank you so much for coming and sharing some ear care tips with us. Is there anywhere that people can reach you if they have additional questions for you related to ENT?
Sure, they're welcome to come to the ENT department in Kenyatta anytime. They will find a lot of people ready to help them. We even have even audiologists there who can test hearing level, and they would be happy.
Okay. All right. Thank you so much for making time for us here on Power Breakfast. The show's not over yet. Man Cave with Willis Raburu coming up. They're talking about money in relationships, so you don't want to miss that. Keep watching, and of course use the hashtag Power Breakfast. We'll be right back.